What is a pacemaker and what are the types of pacemakers? So friends, let's talk about pacemakers today. Your heart has its own natural pacemaker, which is called the SA node or the sinoatrial node. But what happens if this stops working properly, or it slows down, or the impulse generated by it is blocked down the road? That's when the device called a pacemaker comes into play. This device is a small device that is placed under the skin, usually just below the left collarbone. Pacemaker has two parts to it. The first part is a generator with a computer that is placed under the collarbone. And then there is a lead that goes from the device inside your heart, which delivers the impulses generated by the generator. How to know if you may need a pacemaker? The most common symptoms if your own pacemaker is failing could be dizziness, lightheadedness, and especially if these are associated with low heart rate, like in the heart rate in 30s or 40s, with dizziness, lightheadedness, or passing out spells could indicate that the pacemaker of your heart is damaged or not working properly. Now, as I said, the generator generates the impulses which travel to the heart. So it's like an electrical impulse. Sometimes people ask me, if there is an artificial impulse in my body, will I not feel it? So friends, no. You will not feel that impulse, but it will still be powerful enough to generate a contraction in your heart muscle if it is needed. So let's talk about the types of pacemakers that are available. The first type of pacemaker is a single lead pacemaker, which means that is just as the name suggests, a single lead comes from your generator inside the chamber. It could be the atria or the ventricle. A second type of pacemaker is the dual chamber pacemaker. In this pacemaker, there are two leads. The first lead goes to the upper chamber of the heart, which is the right atrium, and the second lead goes to the lower chamber of the heart, which is the right ventricle. The advantage of this is that we can establish synchrony between the upper and the lower chamber of the heart. And it is also good for monitoring purposes, with the device can tell us what rhythm the atria is in and what rhythm the ventricle is in if we need to monitor that. Now, the third type of pacemaker has three leads, also called CRT or chronic resynchronization therapy. This type of pacemaker has one lead in the right atrium, one lead in the right ventricle, and another in the left ventricle. So basically, it helps to improve the pumping efficiency of the heart. And that's why the CRT device is primarily used in someone who has low pumping function and requires a pacemaker as well. Because if someone has low pumping function, it is all the more important that we establish a synchronized contraction in their heart. Because if there is dyssynchrony, one part of the heart is contracting at a particular time and the other part of the heart contracts later on, this dyssynchrony can further worsen the pumping function. So for someone whose ejection fraction or pumping function is less than 35%, we usually recommend CRT device. Now friends, there is another advanced type of pacemaker. It is called Micra. It is basically a small device that is directly implanted in the heart. It is a less invasive procedure compared to the other pacemaker, but it is only for very selected patients who in most cases are high risk for the regular type of pacemaker. I would also like to answer a couple of common questions. Once you have a pacemaker, you can still travel freely. You have to let the airport authorities know you do have a pacemaker because you may require special screening there. You can pretty much do whatever you need to do in your lifestyle. There is a battery of the generator that we talked about. The battery lasts somewhere from 8 to 12 years, depending on how frequently it is utilized by you. So the battery alone will need a change after 8 to 12 years. But the pacemaker and the leads are supposed to stay inside your heart forever, unless there are some complications like infections or whatnot, which do not happen in majority of the people. Also, friends, the good thing about pacemaker is it does not have to always take over 100% of the work of your natural pacemaker. The pacemakers are designed to continuously monitor your own heart rate, beat to beat. So, for example, if your own heart rate is doing very well, then the pacemaker will sit silently and just watch. However, if your own heart SNO malfunctions or there is an AV block, it will kick in right away because it is always monitoring your heartbeat. So it is a good backup mechanism because some people have issues only intermittently. They may not utilize the pacemaker 100%, and that is still okay because the device will still monitor your heart rate and deliver an impulse when your own heart fails to do that. So friends, I hope this video was helpful. And if you have any friend or family member who needs a pacemaker, has been advised a pacemaker or has a pacemaker, then feel free to share this video for them. If you have any questions for me, please feel free to comment in the section below. Thank you.